Imagine the military just, letting $250 billion worth of base housing rot, all while marking the buildings down as totally fine on some spreadsheet.
Right.
Or a hospital literally threatening a spouse with legal action just to clear a bed for a new patient.
Yeah, it's wild.
It is. So today, we're looking at a week of news where the paperwork looks absolutely perfect, but the reality on the ground is just falling apart.
Absolutely.
So welcome to the Deep Dive. We are jumping right into our weekly news roundup for the Veteran Voice Weekly Source Pack, covering the week of August 17th to August 23rd, 2026.
Yeah, and it is a heavy week, but an important one.
Tefel.
Because across all the sources we are looking at today, there's just this glaring recurring through line.
Yeah.
We are constantly seeing this massive gap between the official policies, the polished metrics, the press releases, and, what actually reaches a veteran on the ground.
Right. The reality of it.
Exactly. And what is most revealing is how we actually know this. I mean, agencies rarely expose their own flaws, right?
Oh, never.
Yeah, so this week's reality check comes directly from federal watchdogs.
Right, the independent ones.
Yeah, we are talking about the Government Accountability Office and the Inspector General. The people who actually did the hard work of checking the receipts.
Exactly. Okay, so let's unpack this. I want to start with a story that just perfectly illustrates this gap.
Sure.
Just this past week, the VA announced a $29 million fund for homeless veterans.
Mm-hmm.
And the money is coming from the new Dole Act. And what's interesting is how it's broken down. It's about $11 million for immediate physical goods.
Okay.
Things like food, clothing, phones. And then $18 million for transportation.
Right.
And we definitely know the need is there. I mean, looking at the data, the VA permanently housed almost 52,000 homeless veterans in fiscal 2025 alone.
Wow, yeah.
Yeah, 52,000. But here's the catch. The implementation notice took effect in late July.
Okay.
The big public announcement was mid-August. But the actual physical goods,
Yeah.
those don't start moving until the new fiscal year kicks in on October 1st.
Oh, man.
Right. And the transportation contracts aren't expected to be awarded until sometime in September.
See, it is the classic disconnect between administrative pacing and human urgency.
Yes, exactly.
The machinery of government it moves at its own comfortable speed,
Yeah.
which is completely detached from the daily survival of the individual they are actually trying to help.
It's just baffling. It's like handing someone who is literally starving a gift card in August that doesn't actually activate until October.
Right. Good luck until then.
Right. If a veteran needs a ride to a clinic today, they are stuck relying on the exact same patchy volunteer network they were using before this grand announcement was even made.
Yeah.
Why announce emergency funds if they aren't available for emergencies?
Well, what's fascinating here is let's look at the mechanics of why this bureaucratic delay is so damaging.
Okay.
Because even though $29 million is a relatively tiny drop in the bucket compared to the, 900 plus million the VA issued in homelessness grants last year.
Right, it's a small piece.
Yeah, but this specific fund is designed for extreme flexibility.
Oh, I see.
Right. A lot of times, a veteran is just one hyper-specific, seemingly minor obstacle away from getting into permanent housing.
Give me an example of that.
Sure. So, for example, they might already have a HUD-VA voucher.
Right. The housing voucher?
Yeah, which is a joint program where the housing department subsidizes the rent and the VA provides case management.
Okay.
So they have the voucher, but they don't have a working phone number for the prospective landlord to call them back.
Oh, wow.
Yeah. So a cheap disposable phone bridges that gap instantly.
That makes total sense.
Or, they need a reliable ride to secure a job that will eventually pay the security deposit.
So these aren't massive structural investments. They are tactical fixes.
Precisely. They are tactical fixes that completely lose their value if they are delayed by 3 months.
Yeah, you lose the apartment.
Exactly. So while the administrative gears grind slowly toward October, there is an immediate action step for our listeners.
Yes, please.
If you or someone you know is facing homelessness right now, do not wait for these new funds to activate.
Right.
Call the National Call Center for Homeless Veterans at 877-424-3838 because there are existing active resources that can deploy today.
That's great. Let me repeat that. Keep that number handy, folks. It's 877-424-3838.
Yeah.
So we see bureaucracy trapping basic emergency funds,
Right.
but that same wait-and-see approach bleeds right over into veterans' physical health care, too, specifically with medical innovations.
Oh, definitely.
The Military Times just published an interview with Dr. Ilse Wiechers.
Right.
She's a VA mental health official, and she's tackling a question I hear all the time, which is, if the FDA approves a treatment, why doesn't that guarantee a veteran can get it at a VA clinic?
Yeah, it is a massive point of friction.
I bet.
A veteran reads about a breakthrough for PTSD or, treatment-resistant depression.
Right.
They go to their VA doctor and they just get a flat no.
Just no.
Yeah. And it's because FDA approval is literally just the starting line for the VA. Once a treatment clears the FDA, it has to run a whole multi-office gauntlet.
Like what?
Well, it goes through the Office of Mental Health, the Office of Suicide Prevention, Pharmacy Services, and the National Center for Ethics in Healthcare.
Wait, what are they testing for that the FDA hasn't already cleared? I mean, isn't the FDA the gold standard?
You'd think, right. But they are looking at the specific veteran context.
Okay.
So does the clinical evidence hold up for a population that often has complex, overlapping traumas?
I see.
Does the VA actually have the physical space and the trained staff to administer it?
Logistics.
Right. And financially, does adding this new treatment pull critical resources away from established care?
That makes sense.
And beyond all that, medications have to make it onto the VA National Formulary.
What's that?
It's basically the master list of drugs the VA will actually pay for.
Oh, okay.
And getting on that list has its own incredibly strict criteria.
Okay, I understand the need for safety protocols,
Hmm.
but the timeline is what I want to push back on here.
Yeah.
Let's look at this specific example they cited in the source material. It's repetitive transcranial magnetic stimulation for depression.
Right.
The FDA approved it way back in 2008.
Yeah, a long time ago.
The VA slowly tested it across 35 sites, and now, finally, it's offered at more than 60 VA facilities.
Mm-hmm.
But my question is, why should a veteran have to wait almost 2 decades for an FDA-approved treatment to become widely available?
It's a great question.
I mean, if you are struggling with severe depression, 2 decades might as well be a century.
Oh, the frustration is completely justified.
Yeah.
The VA's internal logic is that this methodical, almost glacial caution, it protects veterans from treatments that might show early promise in a controlled FDA trial, but fail or cause harm in broader real-world application.
Okay, I hear that.
But from a practical standpoint, navigating this system is a lot easier if you view VA treatments in 3 distinct buckets.
Oh, break those down for me.
Sure. So you have available, restricted, and clinical trial.
Okay.
Available is just standard care. Restricted is the no list.
Right.
For instance, the 2023 VA and DoD Clinical Practice Guideline for PTSD has very specific restrictions.
Like what?
They currently recommend against using benzodiazepines, cannabis, and ketamine.
Oh, really?
Yeah, this is exactly why we see so many veterans paying entirely out of pocket for medical cannabis.
Because the VA just won't cover it.
Exactly. The VA simply won't cover it based on their guidelines.
Right.
But then you have that third bucket, which is clinical trials.
Okay.
This is where the cutting-edge therapies actually sit.
Gotcha.
Just recently, on August 5th, the VA opened a psilocybin trial for veterans with treatment-resistant depression.
Oh, wow. Psilocybin.
Yeah. So the pathway to innovation exists, but it's heavily guarded.
Very guarded.
Listeners looking for those experimental options shouldn't just ask their primary care doctor. They need to constantly check research.va.gov to see what trials are actually recruiting.
Okay, that's really good advice. Research.va.gov. But, clinical caution is one thing. Protecting veterans from unproven treatments makes sense on paper.
Sure.
But when that same bureaucracy actively pushes a vulnerable person out the door, the results are catastrophic.
Oh, absolutely.
And this brings us to an incredibly harrowing report from the VA Office of Inspector General.
Yeah, this was tough to read.
It really was. It details the discharge of a veteran in their 70s at the Central Virginia VA healthcare system down in Richmond. Now, this veteran was 100% service-connected.
Wow.
Yeah. They were suffering from severe dementia, metastatic rectal cancer, PTSD, and a traumatic brain injury.
Just a heartbreaking amount of things to deal with.
Truly. So they were admitted to inpatient mental health, and by day 2, the psychiatrist correctly diagnosed dementia with behavioral disturbances.
Okay, so they knew early on.
Yes, very early.
Right.
But over the next 3 weeks, this veteran was wandering, agitated, and getting almost no sleep. And the staff agreed they needed a higher level of care. But community nursing homes refused to take the veteran, specifically because of the behavioral issues.
And here's where it gets really interesting, or I guess tragic is a better word.
Yeah.
Because this is where the system treats inpatient care like an assembly line.
That's a good way to put it.
Right. When the veteran hit day 23, the conveyor belt just moved, regardless of whether there was a safe landing pad at the end of it.
They just needed the bed.
Exactly. With no external facility willing to take the veteran, the hospital staff decided to just discharge the veteran back home.
Even though the spouse said no.
Right. The spouse repeatedly, clearly communicated that she could not manage these violent behaviors alone.
And what happened next is, frankly, shocking.
Yeah.
The hospital staff actually threatened the spouse.
It's unbelievable.
They told her that if the veteran wasn't picked up in 48 hours, they might initiate legal proceedings for patient abandonment.
Which is just an incredible misuse of leverage against a family in crisis.
Exactly. It's treating a human being like a hot potato.
Right.
So they finally discharged the veteran on day 27.
Right.
And their grand support plan. It was just 30 hours a week of home health aid help and a 14-day supply of a medication called haloperidol.
That's it.
That's it.
Yeah.
And that medication ran out in 7 days, leaving the spouse completely stranded.
The timeline that follows exposes exactly what happens when rigid procedures just override human common sense.
Walk us through it.
So 7 days after the discharge, a friend was so terrified for the spouse's safety that they called the Veterans Crisis Line on a Friday.
Okay, Friday.
Right. The responder listened to the reports of violent encounters in the home.
Good.
But instead of triggering an immediate intervention, they just followed standard protocol and entered a routine, non-emergency referral to the hospital's suicide prevention coordinator.
Let me guess. That coordinator doesn't check their inbox on the weekend.
Precisely. It wouldn't even be looked at until Monday morning.
Oh, my God.
And by the time that coordinator reached the spouse on Monday, it was too late.
What happened?
Over the weekend, the veteran had assaulted a home health aide and had been taken to jail.
A 70-year-old with dementia and cancer.
Yes, an elderly veteran with dementia and cancer sitting in a jail cell because a hospital forced an unsafe discharge.
That is just a massive system failure.
It is. The OIG investigated and made 6 recommendations.
Okay.
The healthcare system director agreed to 5 of them, things like immediate retraining and restructuring discharge planning.
Sure.
But they actively rejected the 6th recommendation.
Wait, the one about the weekends?
Yes.
Unbelievable.
The OIG recommended that the Veterans Health Administration create a mechanism for crisis line responders to escalate non-emergency abuse concerns on weekends.
Right.
And the VHA rejected it.
Why on earth would they reject a mechanism to escalate abuse concerns just because it's a Saturday? I mean, that is really hard to process.
Their rationale was they claimed their existing emergency protocols for immediate life-threatening danger were sufficient.
But this wasn't flagged as life-threatening.
Exactly. And they said that creating a new weekend escalation for non-emergency abuse would overcomplicate the workflow.
Wow. Overcomplicate the workflow.
Yeah. The OIG closed the recommendation anyway, noting the VHA had at least thoroughly reviewed it.
Okay.
But we cannot breeze past the actionable takeaway here for any family facing a terrifying discharge scenario.
Right. What can they do?
You have rights that the hospital will not explicitly advertise to you.
So what should a family do if they are handed the paperwork and basically told to leave?
First, anyone can ask for an ethics consultation at the hospital.
An ethics consultation?
Yes. It halts the momentum and it forces a neutral party to evaluate if the discharge is actually humane.
That's a great tool.
Second, if you complain to a patient advocate about a clinical decision, that advocate is required by policy to explain the formal clinical appeals process to you.
Okay.
Do not let the bureaucracy intimidate you into accepting an unsafe environment.
That is crucial advice. Now, we are talking about a localized failure there. Human beings making bad calls in a single hospital.
Right.
Let's zoom out to a digital failure at the Pentagon, where a single keystroke literally stripped away benefits from thousands of people.
Yeah, this one is infuriating.
It is. We're looking at a recent memo from Anthony Tata, the Undersecretary of Defense for Personnel and Readiness. And he reversed a rule that was costing Guard and Reserve troops 6 months of health coverage.
6 whole months.
Yeah. The benefit is called 10MP. the Transitional Assistance Management Program.
Right.
It's designed to give 180 days of premium-free TRICARE coverage to service members and their families after long active duty tours, allowing them to transition smoothly back to civilian life.
That's the idea anyway.
Right. But eligibility wasn't actually based on the length of your service.
No.
It was tied to a tiny code in the Pentagon's DEERS database.
Ah, the Defense Enrollment Eligibility Reporting System.
That's the one.
It is essentially the master personnel registry for the military.
Right. And if your orders weren't explicitly tagged in DEERS with the exact phrase in support of a contingency operation,
You lost the insurance.
you lost it. How can a simple database tag completely override, say, 1,400 days of actual full-time active duty service?
Well, it perfectly illustrates the absolute tyranny of the database in modern bureaucracy.
Tyranny of the database. I like that.
It's true. This restriction wasn't a law passed by Congress.
No.
It was a coding requirement entirely invented by the Defense Department.
Wow.
And it took a massive legal fight to fix it.
Tell me about the lawsuit.
So in April 2026, a Navy Reserve lieutenant commander named Anthony Gontars, who had served 1,400 consecutive days on active duty and then lost his TRICARE just a month after separating, he sued the Pentagon.
Good for him.
Yeah. He partnered with the National Veterans Legal Services Program and the law firm Discharge.
Okay.
So this August memo from TATA essentially undoes that arbitrary coding requirement. Moving forward, reservists do not have to prove their service was connected to a specific war or national emergency to get their transition care.
And there is a massive financial component to this fix, too. We aren't just talking about future coverage.
Oh, definitely not. The back pay is the real headline here.
Right.
Anyone denied TAMP on or after April 24th, 2020 can now ask the Defense Health Agency to reimburse their insurance premiums and out-of-pocket medical costs.
That is huge.
We are talking about potentially tens of thousands of troops.
Yeah.
I mean, more than 160,000 Reserve and Guard members were on active duty orders in fiscal 2026 alone.
Wow.
And we really need to be explicit about who this impacts.
Yeah, go ahead.
Guard and Reserve members across the Pacific Northwest who were activated for extended periods, whether for COVID response, civil support, or, large training exercises, they are squarely in the group affected by this database error.
So they should be looking into reimbursement immediately.
Yes. Get on it. And a quick note on the lawsuit itself. It is only paused for 60 days to see if the Pentagon actually follows through on processing these reimbursements.
Oh, so it's not over.
No, the legal team has not dropped the case. They are keeping the pressure on.
That's smart. So when a veteran is navigating all of this, delayed emergency funds, clinical care red tape, unsafe hospital discharges, and database errors stealing their insurance, the ultimate safety net is often the crisis line.
Right.
But is that safety net actually intact? We've got GAO reports digging into the crisis lines, recently covered by GovExec, pulling data from June 2025.
Okay.
Now, if you look at the VA's internal metrics, it looks like a massive success story.
Sure, on paper.
Exactly. Through fiscal 2025, they maintained an 89 to 99% answer rate. The average wait time for a call was just 8.6 seconds.
That's fast.
Really fast. For a text, 27.1 seconds. And they kept their staffing remarkably steady through a year of federal layoffs.
Right.
But the wider civilian 988 network that the Veterans Crisis Line plugs into,
Yeah, how's that doing?
it is crumbling.
Wow.
The Health and Human Services Coordinating Office dropped from 24 people to just 18 people.
Oh, man.
And a recent survey in JMA found that 71% of 988 centers are severely understaffed.
See, to understand why the civilian network's failure impacts veterans, we have to look at the routing architecture.
How does that work?
So if a veteran dials 988 and then presses 1, they are routed directly to the VA's dedicated Veterans Crisis Line.
Okay, that makes sense.
But if they just dial 988 without pressing 1, they are dumped into that understaffed local civilian network.
Oh, I see.
Alternatively, they can text 838-255 directly to reach the VA.
Okay.
Now, if we connect this to the bigger picture, while the VA's top-line response times are undeniably impressive, I mean, getting to a caller in under 9 seconds absolutely saves lives, the watchdogs are warning us not to just trust the sheer mathematics of it.
Well, I have to question those rosy metrics anyway, especially based on the data from that June 2025 GAO report.
Yeah, lay it out.
Interactions jumped from 800,000 to over 1.1 million in just a few years.
That's a huge spike.
Massive. And the watchdog found that about 47% of chat responders and 35% of text responders reported they often or always handle 2 conversations at the exact same time.
Which is just terrifying.
Right. An 8.6-second answer rate looks amazing on a quarterly report.
Mhm.
But if the person on the other end of the text is juggling your immediate crisis and someone else's trauma at the exact same time,
Yeah.
are veterans actually getting the undivided care they need?
You've hit on the crucial distinction here between a quantitative metric and qualitative care.
Right.
An answer rate just proves the connection was made.
That's it.
It doesn't measure the depth of the interaction or the effectiveness of the de-escalation, or honestly the psychological strain on the responder who is tasked with managing two severe mental health crises simultaneously.
That has to lead to burnout.
Oh, absolutely.
Yeah.
The GAO explicitly told the VA they need to figure out how to measure what actually happens in the 20 minutes after the phone is answered,
Right.
especially for callers with highly complex needs.
Yeah.
So the digital infrastructure is holding up under incredible weight, but the invisible stress on the system is immense.
So we've been talking about invisible infrastructure.
Mm-hmm.
Policies, databases, text routing.
Right.
Let's look at the very visible physical infrastructure where our troops actually live and work.
Oh, the barracks.
Yep. We have an August 21st GAO report revealing a staggering $285 billion backlog in facility sustainment for fiscal 2025.
$285 billion?
$285 billion. And back in 2014, the DoD issued a memo setting its own internal goal to fund routine maintenance at 90% of what their facility sustainment model recommends.
Okay, so 90% was the goal.
That was the goal. But the reality over the last several years,
Yeah.
the Army, Navy, and Air Force only funded about 80%.
Okay, slightly under.
And the Marine Corps. Over the last 5 years, they plummeted down to funding just 40% of routine maintenance.
40%.
Yes. They shifted the money to modernization instead. It's like deciding to skip changing your car's oil for 5 years to save a few bucks, and then acting surprised when the entire engine block cracks and costs you 10 times more to replace.
It is the exact same dynamic, just scaled up to $250 billion.
Yeah.
When you intentionally defer maintenance, skipping roof inspections, ignoring minor leaks, delaying HVAC repairs, it drastically accelerates the decay of the entire structure.
Area we've seen.
Right. We discussed the 2023 GAO Barracks Review previously, which found thousands of service members living in substandard, sometimes hazardous barracks full of mold and broken plumbing.
It's disgusting.
It is. And as of April 2026, the Pentagon had only implemented 19 of the 31 recommendations from that report.
That's not great.
No, they still haven't even established a proper oversight structure. But this new report identifies two profound root causes for why this backlog keeps growing.
Okay, what is driving it beyond just, moving the money around?
First, severe worker shortages.
Okay.
This is particularly acute at remote and isolated bases where the military simply cannot compete with private sector pay to hire plumbers, electricians, and carpenters.
That makes sense.
Second, the work order systems themselves, the databases tracking the repairs, they produce data that is utterly unreliable.
Wait, so the data is broken too. They don't even know what needs to be fixed.
It is actually worse than that.
How could it be worse?
They don't even know if the maintenance they do manage to pay for is actually working or being completed properly.
You're kidding.
No. The data is so corrupted that the GAO is essentially demanding the Defense Department stand up and say out loud what risks they are accepting by underfunding this.
Right.
By pretending the buildings are fine on a spreadsheet while funding them at 40% in reality, they're completely obscuring the true human and financial cost from Congress and the public.
Wow. So what does this all mean? When we step back and look at the whole picture today, across a $29 million homelessness fund trapped in a bureaucratic timeline, FDA-approved treatments taking decades to reach VA clinics, an assembly line hospital discharge leaving a family in danger, TRICARE benefits stolen by a single database code, crisis responders forced to juggle multiple suicidal texts, and a $285 billion maintenance backlog rotting our barracks.
It's a lot.
It is a lot. The through line is undeniable. The paper promises made in press releases rarely match the ground reality experienced by the veteran.
Yeah, and this raises an important question, and it is something I want our listeners to really mull over today.
What's that?
Notice how almost every single correction we discussed this week required a massive external push.
Yes, exactly.
It took a federal watchdog like the GAO and OIG auditing the books to expose the barracks backlog and the hospital discharge failure.
Right.
It took a Navy reservist partnering with lawyers to file a federal lawsuit to fix a database code.
Yep.
The system didn't catch its own errors. It was forced to fix itself.
Yeah, from the outside.
So, if the system relies so heavily on outside watchdogs and individual veterans risking their own time and sanity to force accountability, what happens to the invisible cracks in the system that a watchdog hasn't audited yet?
That is a chilling thought to end on, but
Oh,
it is exactly why we do this deep dive.
right.
We have to keep looking for those cracks. So thank you all for joining us today and going through this source material with us. Stay curious, stay vigilant, and above all, stay well informed. We'll catch you on the next deep dive.